Hello everyone, my name is Petugo and today I will be demonstrating about vital signs where we are taking the patient's blood pressure, heart rate, respirations, and temperature. Vital sign is an assessment of our general health. They alert us to early indications of an infection, guard against incorrect diagnosis, and motivate us to make wiser decisions. But before we are getting started, allow me to introduce the devices we'll need for the assessment we're doing today. To check the patient's temperature, we'll need a digital thermometer, cotton balls, and alcohol to clean the equipment before and after use, a sphygmomanometer and stethoscope, which are used to check the patient's blood pressure, notebooks and writing materials that used to document the data that being gathered, and the second-hand wristwatch, which is used to assess the measurements of the respiratory rate and pulse rate. Now, it is crucial for our equipment to be organized and accurate because it ensures our effectiveness as nurses. Let's proceed to assessing the temperature. Temperature is the difference between heat produced and heat lost by the body and is measured through the use of a digital thermometer. First thing we have to do is introduce ourselves to our patient, verify the patient by looking at their identifiers or armband and having them tell you their name and their birthday. Also, tell the patient what we are going to do. This is to obtain necessary data from the client, and when the patient knows what is to be done, he will cooperate better. So, ma'am, I am Caitlin A. Petugo, your student nurse for today. May I know your name, ma'am?
Kyle Angeline Pio Quinto,
And your birthday, ma'am?
August 5, 2004.
Thank you. So, ma'am, we are going to check your temperature. Is it okay with you?
Okay.
Thank you. After that, I will do my medical hand washing. This is to deter the spread of microorganisms. Then I will provide the client privacy by closing the curtains or closing the door of his or her room and adjust the temperature. Now, I will position the client in a sitting position to obtain her oral temperature. First, let's sterilize the thermometer by using an alcohol swab in a firm twisting motion from the bulb to the stem. This twisting helps to come in contact with the thermometer's entire surface. Now, please open your mouth. I will leave the thermometer in place until the signal or beep is heard. Then I will remove the thermometer and tell the client his temperature. Ma'am, your temperature is 36.7 and it is normal. Then, after that, I will wipe the tip of the thermometer with an alcohol swab from stem to sensor in a firm twisting motion. This is to deter the spread of microorganisms. Next is I will perform an axillary temperature. Then, I will move the gown and sleeve away from arm and shoulder and I will raise the arm away from torso and inspect axillary area for lesions and perspiration. Then, I will pat the axilla dry, especially if very moist, and place the tip of the thermometer in the center of the axilla and ask client to lay the arm over the tip and across his chest. I will then turn the thermometer on. This is because moisture in the axilla may alter the result of temperature. The deepest area of the axilla provides the most accurate temperature measurement. Then, I will leave the thermometer in place until the signal or beep is heard. Allowing sufficient time for the axillary tissue to come in contact with the thermometer bulb result in a reasonably accurate measurement of body temperature. Then I will remove the thermometer and tell the client his temperature. Ma'am, your temperature is 36.9, which is normal. Then I will wipe the thermometer, the tip, with an alcohol swab from stem to sensor in a firm twisting motion and remove and discard any glasses of light and perform hand hygiene. This is to deter the spread of microorganisms. Then I will record the temperature reading in the PPR sheet, and I will recheck the temperature if the temperature is obviously too high or too low or inconsistent with the client. This is to prevent an incorrect temperature reading. And then I will wash the thermometer if necessary and return it to the storage location. Then I will document the temperature in the client's record, and for example, the TPR monitoring sheet. And now let's assess the pulse rate. The pulse is a rhythmical throbbing that results from having blood pressure through an artery as the heart contracts. The first thing we are going to do is to introduce ourselves to the patient and verify their name and birthday, and also tell them and explain to them what we are going to do. This is to obtain necessary data from the client, and when the patient knows what is to be done, he or she will cooperate better. So, ma'am, good morning. My name is Caitlin A. Petugo, your student nurse for today. May I know what's your name, ma'am?
Kyle Angeline Pinto.
And your birthday, please?
August 5, 2004.
Thank you. So, ma'am, we're going to measure your pulse rate. Is it okay with you?
Okay.
Thank you. And after that, I will perform a hand hygiene. This is to deter the spread of microorganisms. Then, I will provide the client privacy by closing the curtains and doors and also adjust the temperature of the room. Then, I will select the pulse point normally. The radial pulse is taken unless it cannot be exposed or circulation to another body area to be assessed. Then, I will assess the client's comfortable sitting position or resting position. Then, I will place my 2 fingers in the inner wrist of the patient and press gently against the radius, resting my thumb on the back of the patient's hand or patient's wrist. The fingertips, which are sensitive to touch, will feel the pulsation of the patient's radial artery. If the thumb is used to palpate to the patient's pulse, the nurse may feel her own pulse. So, use my wristwatch with the second hand. I will count the numbers of pulsations felt for 1 full minute. Sufficient time is necessary to detect irregularities or other defects. Then I will assess the pulse rhythm and volume. If the pulse rate is abnormally in any way, I will repeat the counting to determine accurately the rate, the quality, and the volume. When the pulse is abnormal, longer counting and palpation are necessary to identify most accurately the unusual characteristics of the pulse. So ma'am, let's measure your pulse rate, the wrist. Okay, so ma'am, your pulse rate is 85 beats per minute, which is regular and normal. Then I will document the pulse rate and rhythm and volume in the client's record or in the PPR sheet. And after that, I will perform a hand hygiene. And now let's proceed to obtaining the respiratory rate. Respiration is the exchange of oxygen and carbon dioxide between the atmosphere and body cells and is initiated by the act of breathing. The first thing we have to do is to introduce ourselves to the patient, verify the patient by looking at their identifiers or armband and having them tell what is their name and also their birthday, and also tell that patient or explain to them what we are going to do, because this is to obtain necessary data from the client, and when the patient knows what is to be done, he will cooperate better. So ma'am, good morning. My name is Petugo and I'm your student nurse for today. May I know what is your name, ma'am?
Kyle Angeline Pinto.
And your birthday, please?
August 5, 2004.
Thank you. So ma'am, we're going to check your respiratory rate. Is it okay with you?
Okay.
Thank you. And after that, I will do my medical hand hygiene. This is to deter the spread of microorganisms. Then I will provide the client privacy by closing the curtains or closing the door of his or her room, and also adjust the temperature. Then we will use a watch with a second hand, and I will count the number of respiration for 1 full minute. While doing this, I will observe the depth, rhythm, and character of the respirations by watching the movement of his chest or her chest. A complete cycle of inspiration and expiration constitutes the one act of respiration. Sufficient time is necessary to observe rate, depth, and other characteristics. Now, we'll perform the respiratory rate. Let's put your hand here and let's check. Okay. So, ma'am, you have 16 breathing per minute, which is normal, and labored and regular breathing. So, after that, I will document the respiratory rate, depth and rhythm, and character of the appropriate record on the TPR sheet. Then, I will perform hand hygiene. So now let's proceed to obtaining the blood pressure. Blood pressure is the lateral force exerted by the blood in the arterial walls. The first thing we're going to do is to ensure that the equipment is intact and functioning properly. Check for the cuff size and leaks in the tubbing between the cuff and the sphygmomanometer. Using a faulty equipment or using a blood pressure or cuff that's too small or too large can give you inaccurate blood pressure findings or readings. Then, we have to do is to introduce ourselves to our patients and verify the patients by looking at their identifiers or armband and having them tell their complete name and their birthday. And also explain to the patient what we are going to do. Good morning, ma'am. My name is Petugo, your student nurse for today. May I know your complete name, ma'am?
Kyle Angeline Pinto.
And your birthday, please?
August 5, 2004.
Thank you. So, ma'am, we're going to perform a blood pressure. Is it okay with you?
Yes, okay na.
Okay, thank you. And after that, I will make sure that client has not smoked a cigarette, ingested beverages that contains caffeine, or has had any strenuous activity within 30 minutes. Nicotine causes vasoconstriction in the peripheral and coronary blood vessels, which may cause an increase in blood pressure. Caffeine is a stimulant that increases blood pressure and also doing strenuous activity. After that, I will determine best side arm to use. It's best to take blood pressure in the non-dominant hand, which is the left if the patient is right-handed. So, ma'am, are you a left or a right-handed person?
Right-handed.
Okay, thank you. Then, I will position the client appropriately. The adult client should be sitting unless otherwise specified. Both of feet should be flat on the floor. The elbow should be slightly flexed with the palm of the hand facing up and arm supported at heart level. I will then expose the upper arm. This position exposes the brachial artery so that a stethoscope can rest on it conveniently on the antecubital area. Then I will place the cuff so that the inflatable bag is centered and lies midway over the anterior surface of the brachial artery. The surface of the brachial artery should be at the center of the two tubbings of the cuff. Pressure applied directly to the artery will yield most accurate readings. And then I will use my two fingertips to feel a strong pulsation in the antecubital space. Accurate blood pressure readings is possible when the stethoscope is directly over the artery. Then I will just pump until the pulse is disappeared. Then deflate the cuff. So, I already obtained the estimated systolic pressure, which is at 120 millimeters of mercury. As for the final taking of the blood pressure, we're going to add 30 millimeters of mercury above the higher estimated systolic pressure. But first, I will position the stethoscope appropriately. Clean Rinse the earpiece with an antiseptic wipe or then insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. Ensure that the stethoscopes hang freely from the ears to the diaphragm. Place the diaphragm or the amplifier of the stethoscope over the brachial artery pulse. Place the stethoscope directly on the skin, not on clothing over the side. Hold the diaphragm with the thumb and index finger with the rest of the finger supporting the elbow. I will then oscillate the client's blood pressure. Pump up the cuff until the sphygmomanometer reads 30 millimeters of mercury above the point where the brachial pulse disappeared. Release the valve on the cuff surface so that the pressure decreases at the rate of 2 to 3 millimeters per second. As the pressure falls, identify the manometer readings at carotid cuff phase 1, systolic BP, first tapping sound here during deflation of the cuff. Carotid cuff phase 4, first diastolic BP, the time when the sound becomes muffled and have a soft blowing quality. And carotid cuff phase 5, second diastolic BP, the pressure level when the last sound is heard. This is followed by a period of silence. Deflate the cuff rapidly and completely. This will prevent you from missing the first tap sound as a result of the osculatory gap period where no sound is heard. First sound is the systolic BP and the last sound is diastolic BP. So I already obtained her final blood pressure, which is at 170 millimeters of mercury. Next, I will remove the cuff from the client's arm. Then I will wipe the cuff with an antiseptic wipe or approved disinfectant. I will then document the report with the patient's measurement and assessment data according to the agency policy, and this is to take note of the findings as the record. Then now I will provide the client's opportunity to ask or raise for concerns, and don't forget to thank the client for the time of cooperation. So ma'am, do you have any concerns?
None.
Okay, thank you. So Miss Pioquinto, upon taking your vital signs, your result shows that it is all normal and you don't have to worry because I will monitor you from time to time. So do you have any concerns or clarification, Miss Pioquinto?
None.
Okay, so thank you so much for your time and cooperation. Have a nice day.
Thank you.